La naturaleza de las cosas. Con David Suzuki.
Cosas, fobias en línea.
And makes them unable to function, no matter how much they want to function. And in their most severe form, it's just as severe and even more disabling than most of the chronic physical disorders.
There were times when traveling through a tunnel, I would have such extreme anxiety. It seemed that we would never get out of the tunnel. Should I get out of the car? Should I walk? And my heart was pounding, and I was afraid that I couldn't breathe, and it would escalate and escalate and escalate.
There we go.
Los síntomas físicos de estos miedos psicológicos son muy fuertes.
What we want to do is begin to get you a little bit dizzy.
Yes.
Los síntomas son tan intensos que hasta el personal médico puede confundir un ataque de pánico con un infarto.
All right, let's stop there.
Ooh.
Okay. Now, tell me the sensations you're experiencing.
Well, I feel, of course, I'm spinning the other way now.
Yeah.
My eyes are having a problem focusing.
Problem focusing?
Yeah. Well, I mean, I'm spinning, so.
Yeah, and if you were a patient, we'd say, are those any of the sensations
Wow.
you experience when you have
And
it?
sometimes that is how they say they feel?
Yeah, we
Wow,
get some patients with what we call audiovestibular kind of types of panics who just feel as if they're going to get dizzy, fall down, and pass out.
So as we turn around the corner, you're going to see quite a height here.
Pero un tratamiento llamado terapia conductista cognoscitiva expone al paciente a las cosas que más teme.
Any thoughts going through your mind right now about this height?
I'm just hoping you don't ask me to stand there.
Okay, what would happen if I asked you to do that?
Then my anxiety will probably go to a 7 or an 8.
It's just for a regular phobia of...
En la Universidad de California, en Los Ángeles, la psicóloga Michelle Krask y sus colegas usan la terapia conductista para ayudar a los pacientes con fobias.
Right.
So you're anxious, but it's...
Cuando las personas con fobias se enfrentan a eso que temen, muchos de ellos experimentan un terror absoluto. Ese terror queda tan impreso en sus mentes que terminan por temerle al miedo en sí mismo. Durante sesiones de exposición, los pacientes aprenden a controlar el miedo.
As you can see, this is a fairly small space. There's a chair in there where I'll have you sit down. The handle has been modified, meaning that you're unable to open the door from the inside. Okay? What level of anxiety does that generate?
Well, I put it more or less, I guess around between 5 and 6. It's starting to rise when you mentioned I could not, open the door from the inside, and my palms are becoming sweaty and so
Okay,
forth.
let's feel.
Yeah.
Right, I feel that.
Yeah, just starting
Right.
to become moist.
Let's just have a look at the heart rate monitor here. Okay, so you're at about 92 beats per minute. Why don't you have a seat? Just have a seat and
Okay.
you're checking the ventilation.
Oh, yeah. Certainly.
Exposure is having the person systematically confront the thing that they're afraid of. If it's haphazard, if they happen to confront the object and don't do it in a systematic or controlled way, to sensitize them. So it is essential that it's systematic, controlled, and by doing that we refer to having completed exposure therapy. So shall we try that? Are you willing to go with that, where I just close and open the door?
Yeah, we might as well see if it gets stuck or not, go through
Okay.
that process.
All right, let's see. I'm closing the door,
Okay.
and I'm opening the door.
Okay.
All right, you see what I'm doing?
Yeah.
I'm closing the door, I'm opening the door.
Okay.
I'll let you go at your own pace and slowly get your hand further in. That's great. You can hold it there for a while. Don't have to push yourself right now. And just get used to that. How's your anxiety like now?
It's a little higher now.
Okay. Good. You're doing a very good job. I can tell you're really focusing on the spider. That's important. No, that is.
No, well, that's not why I'm focusing on the spider, though.
You're focusing because?
Well, I just want to be prepared.
So do you have an image of yourself falling over the edge?
Yes.
Okay. All right.
Las personas con fobias creen que aquello a lo que temen realmente pasará. Si se deja sin control, este pensamiento negativo retroalimenta la ansiedad del paciente y la empeora cada vez más.
Are you feeling any of the dizziness?
No, but I'm feeling anxious.
Okay. All right. What do you think are the real chances that I wouldn't be able to open the door?
If I was on the outside looking in, probably slim and none.
Slim and none.
Yeah.
So we're close to the zero or at zero.
Yeah.
And when you're thinking about it and getting anxious, it feels like it's a true possibility.
Oh, yeah.
Okay.
Like you won't believe, yeah.
All right. So that's prominent in your mind. So where would you put it on the 0 to 100-point scale?
Realistically?
Realistically.
Oh, probably from 0 to maybe 2, I guess. 0.
So every 100 times I close this door, it happens twice that it gets stuck.
No, I don't think so.
No, it hasn't happened.
No.
So even that is an overestimate.
Yeah.
So it's important to catch the thoughts when they happen and say, there's that thought, let's question it. Let's really try to put on a different role, become an observer of myself and question those thoughts. So we'll continue with this for a while.
Okay.
Okay, good. Just like that.
I feel okay like that.
I've worked with patients who have become very angry at me, have sworn at me, although afterwards it was fine. Patients who have thrown up when they're doing exposure therapy. So it does, in a way, take a special person who's willing to go with it, knowing, of course, that in the end it's effective.
Do you feel ready to try to touch the spider without the glove? Or would you like to try the latex glove?
I'll try it without the glove.
Okay, great.
Let's pull on this rail, pull it towards us. Let's push it away, pull it towards. Good job. Not ready?
No.
Okay. One arm. All right. Other arm.
I'm not going to really lean on it. I'll just rest my arm on it.
Okay.
Los pacientes responden rápidamente a la terapia conductista. Una sola sesión puede producir resultados sólidos.
Ron. That was 5 minutes.
Oh, okay.
Great job.
Yeah.
Just have a look at the heart rate monitor.
Oh, really? Oh. I bet 77, I guess.
77? All right.
That was great to watch this. Well done, Ron.
Oh, thank you. Thank you very
great.
much.
Boy, that's hard work for you, too. You really have to concentrate and
That's right.
try to follow what he's thinking and talk him down.
Right. Trying to capture some of the thoughts is the important part. Did you think that it would have been this quick?
No, I thought it would be just like, I'd be breaking down this door and going like, oh shit, let me out. Excuse me. I mean, let me out of here, and I'd be panicking and Craig doing crazy stuff like I normally do.
Ron was fairly tough. He went through it fairly quickly. Some people it takes a little longer than this, but generally speaking, it's fairly dramatic.
And the prognosis for Ron in terms of elevators is...
Yeah. Practice with elevators.
What's your anxiety like?
You know, it's actually mild.
And you're touching the spider.
Yeah.
You see so many people who are really so happy after going through the treatment. They've been able to accomplish something they never thought they could. One issue that's sort of important there is that if there's too much of that sense of did I really do it or not, that to me would be a signal. I think we need to do it again so you really understand that you have done this.
Okay.
Good.
I can deal with this.
Good. All right.
Still dizzy, but not as anxious. I'm okay. Not anxious. I'm excited.
That's great.
Oh, boy. Wow.
It's always my heart starts first. It just starts racing really rapidly, and then sometimes I feel really dizzy and just sick, and I feel like I'm gonna die, and I'm cold all over and shaking a lot.
Jenny, quien estudia música y quiere ser cantante profesional, padece de un tipo de ansiedad que experimentan muchos artistas.
Some of the worst experiences I've had is getting up in front to sing and nothing would come out. I could not sing at all. Just literally, no. None of the notes would come out, so that was very frightening.
All of our severe anxiety disorders or severe emotional disorders can tell us, on the one hand, this is irrational. I know there's nothing to be afraid of. I know there's no reason to be this depressed. I know there's no reason to have these thoughts. They're totally irrational. But on the other hand, when I'm having them, they dominate my life. I really am
El tratamiento dura varios meses. La terapia conductista funciona con los trastornos de la ansiedad.
What I'd like to ask you to do today is to sing in front of a group of people. How do you feel?
I feel pretty nervous about it.
Sure.
Yes.
Otras terapias ponen más énfasis en las causas de la ansiedad, pero el conductismo se enfoca en los síntomas.
The analogy is if you have a broken leg, what we want to do is fix your leg, set it, and get you walking again. Eventually, we may want to go back and see what you were doing that was so stupid that made you break it in the first.
Yes. Okay. I will be singing Sense for My Dear by Henry Purcell. Sense for my dear, my dear.
We want to deal with the present. We want to deal with the here and now. We want to create these symptoms so that we can work with them right there and help the patient to overcome any fear and anxiety.
2 months ago, I would have just really been panicking. My thoughts would have been out of control. And with some of the techniques they've taught us there, it's really about, how you're thinking, to calm yourself down, doing a lot of deep breathing. And so today, before, I have all these tools now I can have before.
Every year, new developments come along to help make these treatments even more powerful. One good example is, of course, virtual reality. It's going to be a godsend for hundreds of thousands of people suffering from severe phobias, where we have difficulty recreating the situation.
It's probably like a 60.
El miedo a volar es una fobia común. Trish padece de ella desde su adolescencia.
How similar to how you feel during an actual flight is this?
I'm feeling it in my upper body, my back, like a tension, and I'm taking really shallow breaths. I think my heart is beating probably less rapidly, and my hands aren't as sweaty.
Okay.
But it's still realistic. It's the most real that I've felt. I mean, it really plain. What happens when I fly is I fly. There's too much time between the times that I fly, and I build myself back up again so that it's like I've never flown before. My anxiety gets up there, whereas if I have an opportunity to fly like this over and over and over, I think it would make a big difference.
Are you all right if we move into a slightly rougher flight?
Okay.
Okay, so we're going to be experiencing some turbulence and flying through a small thunderstorm.
Small thunderstorm.
Okay, it's going to happen pretty quickly, all right?
Okay. The thunderstorm is something that I can honestly say I've never flown through. If I had, I'm sure I'd be extremely anxious. But I think even that is something that, if I could practice, I wouldn't get the panicky feeling.
And typically, if this were a real flight and we were about to land, how anxious do you think you'd be? Much more anxious?
I'd be like off the scale.
Okay.
Rum.
We inherit a tendency, precisely, or at least we don't think so. And we don't inherit panic attacks precisely, but we do inherit kind of a general tendency to be high-strung and maybe a likelihood to experience these things.